Hi there, we are here in the studio today. I'm with Dr. Steven Swengel, board certified dermatologist at Refined MD in Los Gatos, California. Dr. Swengel is here today to answer some of our viewers' questions about one of our latest and newest fractional laser treatments in our office, known as a Moxie laser. This is a thulium 1927 nanometer laser. Dr. Swengel is going to delve into the details of that, but thank you for coming. What do you have to say about that after that introduction, Dr. Swengel?
You pretty much brought up all the points that I was going to bring up, so I don't know if there's a lot to be done, but you know, I have a whole spectrum of fractional laser treatments that people can avail themselves. And I think Moxie is kind of in the middle of the treatment spectrum. The beauty that I find with Moxie is that it gets people some amazing results if you do a series of 3 or 4 of them, but there's really no downtime. You're just totally functional the next day after the treatment. So this is the beauty for me, is that it's safe, it's easily recovered, it's safe on all skin types. So it's just a go-to treatment for people who just don't want the downtime.
So, question. If, you know, there's a lot of lasers and a lot of our viewers are confused by what lasers do you use for what skin condition, who's best for what treatment, but like, if Moxie is a relatively new laser in the marketplace, right?
No, it's the newest kid on the block, but the technology has been there for years.
Got it.
You know, if you you probably have heard of other lasers, most of which we have, but Clear and Brilliant, the Fraxel Dual, the LaserMD, all these are thulium lasers. So the beauty of thulium is it's a totally colorblind, water-focused energy. So it's, again, very safe to use on all skin types.
What's the benefit of a water-focused laser, you call it?
It's a cooler laser, so you don't generate a lot of heat. You know, obviously my classic hot laser is a CO2 laser, and that one you have to be very careful with skin types. And in fact, any skin type can not only have problems with loss of pigment, but also hyperpigmentation, and even kind of this porcelain-like change to the skin, just because the heat denatures the protein to the point that it never recovers.
That doesn't sound good.
Well, you know, it's funny, we don't, because we've taken CO2 and the erbium into fractional laser again, rather than what we call a fully ablative laser, we're just not seeing that injury as much. But I have said that years ago, you could pick out the women who had done a fully ablative CO2 laser, and their skin just had this, you know, waxy porcelain look to it because it had been damaged beyond its ability to recover in a natural way. Fractional lasers, no matter what sort of strength you're using or what technology you're using, you recover well because you don't injure all the skin.
That's very interesting distinction between ablative and non-ablative. Why don't we go ahead and answer some of our viewers' questions about the Moxie laser, which we're here to talk about today, and delve right into those specific questions. Patients have been asking us what a Moxie treatment is like. Can you just describe just a quick overview?
Well, a Moxie treatment is actually one of the easiest treatments that we can provide in the office. It's a fractional laser, so what it's doing is just drilling small little holes in your skin, but in a very controlled fashion, so that the skin is allowed to heal very quickly. Downtime is really minimal, 2 days, but I even say within 1 day you're good to go, you're functional. You have this appearance of just being tanned, because that fractional laser actually kind of you know, causes that skin to burnish for a while, and then that becomes just kind of a somewhat rough sandpapery feel that, again, most people wouldn't even notice, but you'll feel it, and then in about 3 or 4 days that sandpapery sort of feel just disappears.
So I'm curious, you mentioned it's kind of like drilling little holes in your skin with a laser. That doesn't sound good, but how does that work? Why does that improve your skin?
Well, it's actually very superficial. I have lasers that can go a lot deeper. I have lasers that can draw blood because they're drilling holes deep enough to actually hit the papillary dermis. This is really pretty much in the epidermis itself.
So it's actually healthy to drill those holes?
Yeah, and because what happens is the skin, when it's injured, it signals deeper tissues to increase blood supply and increase, you know, kind of the repair process, so that even though you're not damaging that deep, you get signaling from the surface to actually cause a repair process that occurs at a much deeper level. So every time you do one, your skin just gets better and better.
Is there anything you tell patients to do or prepare for before a laser treatment, or some things that they can or can't do after the treatment to make it better?
No, I mean, Moxie is actually pretty color blind as far as skin types. So even if someone came in and were tanned, obviously with that sort of tanned moment, we can't do BBLs. We can't do something specifically for pigment and melanin. But this is just a nondescript fractional laser that injures the surface of the skin.
So if you had to just cite the ideal patient for a Moxie treatment, who would it be? What decade of life are they in? Is this somebody that's a little older that's trying to, or is this somebody doing a prejuvenation, somebody in their 30s?
I think that's 30s and above, but I think there's a point when I say to people that a Moxie is not going to be a restorative treatment for people who are really past the point that they're just trying to improve texture, pore size, and fine lines.
So that's an important distinction. You try to draw between prevention and restoration?
Yeah, I mean, because someone who comes into the office who is 70 years of age has done nothing to their skin. They definitely have, well, first of all, very thin skin. Secondly, usually a kind of a crepe papery change to their skin, and probably enough laxity where you kind of are now saying, no, they need a facelift. So it's not something you would use in lieu of a treatment that's appropriate for their age and what's going on with their skin. So for example, if you came in, I'd say, yeah, that's a perfect treatment. For me, it's a perfect treatment right now. And it's, again, one of my favorites because the downtime is minimal and it's a very easy treatment to go through.
So speaking of downtime, how much, what's the aftercare like? How much downtime should somebody expect?
Well, when we're finished, we actually put various serums and a post-laser balm on. And that's, that's kind of all you use for the rest of the day, because it's really important not to put like a sunscreen on that can penetrate into those little penetration points. And everyone, I'd say, they walk out of here feeling kind of hot. And my little signal to them is when you're on your way home, just turn your AC vents on full blast, point them at your face, and usually by the time you're home, the fire's out. And then you start kind of see that bronzing, browning sort of change that occurs for the next 3 or 4 days. So but you're totally functional.
Okay. So when do patients typically begin to see results, and how long do those results last?
Well, again, what I say, Moxie, when you're dealing with a fractional laser that is very superficial, zero if not just a little bit of downtime, it's not going to just be one and done. This is not a really aggressive treatment. So I say to people, you should be looking at maybe 3 in a row to really start getting some results, and then probably looking at doing a couple per year just to maintain results. I'm also a firm believer you've got to be using active product at home to kind of support the whole process that we're doing here in the office.
Awesome. Well, thank you for joining us today and answering some of the most pressing questions about the Moxie laser treatment. If you have any other questions, you can certainly send them to us at RefinedMD, and we appreciate all of you guys for watching.
Well, and also check out our website, see some before and afters. We did studies for Sciton for this, so that we're really experts on how the Moxie works, and are able to give people and demonstrate some good results.
So the pros of a Moxie treatment are it is safe for all skin types and all skin tones, and it's kind of a year-round treatment. It's also ideal for men as it can be done over the beard stubble. Another benefit of a Moxie treatment is multiple treatment sessions deliver noticeable improvements in the skin's texture and browns or red tones. Another benefit of a Moxie treatment is it's a good maintenance option for those who have had other more significant laser treatments, as well as it provides prejuvenation or skin rejuvenation for younger people as well. So Moxie is a quick lunchtime procedure that can be done in less than 30 minutes. It does involve topical numbing, and after a consultation with your provider, your skin initially is thoroughly cleansed, and then the topical numbing is applied. Then you'll be given goggles, and to protect your eyes from the laser light. Then your provider actually will use the laser handpiece and the laser tip and roll that across your face. So this laser's energy is delivered in a rolling fashion across the face. Once the treatment is over, your provider will provide you with a topical serum or a balm to calm your skin and protect your skin. So what are the cons of a Moxie laser treatment? The first drawback is that this is a laser treatment that, because it just makes incremental improvements in the quality of your skin, it does require multiple treatments to achieve final results. Second, a laser treatment such as Moxie or any other laser treatment for that matter can activate oral herpes, or otherwise known as cold sores, and that's kind of an unpleasant side effect. So I'd speak to my doctor about pre-medicating if you are predisposed to that condition. And then a third con for a Moxie treatment is that it can involve some rebound pigmentation if the laser treatment becomes a little too hot in an area and there's not sufficient cooling. Some skin types, especially darker skin types, might experience some hyperpigmentation that is reversible, but of course that's a little unfortunate temporary side effect. So, great question. What is our level of involvement or knowledge with Moxie? We were involved with Sciton Laser, which is a company in Palo Alto, California, since the beginning of the development of this product, and participated in clinical studies to help them validate the results and the benefits of this treatment. So many of the early patients and the photos that you see in the brochures and online actually were patients that were seen in our office. So does Moxie have any risks or side effects? Great question. Overall, Moxie is a very safe treatment, very few side effects. What you do notice after a laser treatment is your skin has a little bit of minor redness that lasts for several hours, maybe a little bit of mild burning or burning sensation, but that just is a few hours after the treatment. It's also normal that 2 to 3 days after the treatment, your skin is going to have a sandpapery texture that will perhaps remain for 3 to 5 days, and then overall it just sloughs off in the shower. We talked about earlier about activation of kind of oral herpes or people that got cold sores. That's definitely a risk, and you can pre-treat for that or discuss that with your physician, and they can provide some preventative medication that you can take before your laser treatment. And last, I suppose, is the heat from the laser in some individuals could, in rare instances, cause some hyperpigmentation in the area treated, exactly why you're trying to do probably doing the laser in the first place. So that's a bummer if you get it, but we have ways of treating hyperpigmentation in the office. And of course, just to reassure you, pigmentation always goes away eventually, so it's not a permanent side effect. Hi, so we're here today with the latest innovation from Sciton in terms of a thulium laser, which is 1927 nanometer. So this is kind of the best of the best when it comes to refining your complexion. It's safe on many skin types. Your doctor would have to weigh in on exactly the right parameters to use to treat your skin. But this laser was introduced about a year and a half ago on the marketplace. And initially, when there were just trial models of this, Dr. Swengel and the team here at Refined MD did several studies kind of validating the use of this laser on different skin types. So we are very familiar with the use of this laser, and we'd welcome you to come in and have one of these customized treatments to see what difference it can make for your skin. If you zoom in, and you can kind of see we have control of various parameters, the amount of energy being delivered in terms in millijoules, the total coverage that we're going to achieve after we do a certain number of passes, as well as how many passes we're going to do. So the machine tracks that, and there's some predefined levels, a level 1, level 2, level 3. We can use those, or we can totally customize the amount of energy that we're delivering to your face or whatever other body part we're treating. The handpiece for this device involves a single-use per patient, magnetically attached treatment head. It fits right here. It has 2 rollers, which deliver the energy only when the handpiece is in motion, being moved across your skin, like that. So a little bit of numbing, topical numbing, is definitely makes this treatment more comfortable. Because it can be a little spicy if you try to do it without numbing. Usually half an hour to 45 minutes is all you need for topical numbing. Your skin, a day or two after, will become a little sandy and kind of rough textured like sandpaper. But by day 5 or 6, that should all slough off, and you should have smooth skin again. Full resolution, even for the most kind of persnickety patients, I would say would be 7 days for full resolution of kind of all the treatment sequelae. So that's Moxie, and on the MJewel platform by Sciton. We have it here at Refined MD. It's often a better treatment when we do a series of 2 or 3 to get the ultimate results. So you've got to think of Moxie treatment as a treatment that improves your complexion. So it's texture, pores, browns, to some minor extent, minor wrinkles as well. So this builds collagen in the skin. It's a wavelength that targets specifically water in the skin. So the sensation to the patient is heat.